Welcome back. My next guest is Dr. Joe Gerhardstein, who is my partner at Family Practice, and we know him as Dr. Joe. Welcome.
Thanks, Jeff.
Now, at one of our meetings, we were talking, and we were talking about, we're in the flu season, we were talking about how to take care of flu and bronchitis, and one of your big words of wisdom stuck with me. You said, we don't only take care of bronchitis and the flu, but we got to take care of the whole patient, and a lot of these patients have chronic illnesses we got to pay attention to. And a lot of our people do. They've got the flu, but they also have diabetes and high blood pressure. So tell me some of the key things we focus on like your diabetics that they may want to know. Is there a number we need to know about?
Well, there's all kinds of numbers we look at, one of which is the A1C or hemoglobin A1C, and that helps me to look at, on the average, how's your blood sugar running. The American Diabetes Association says try to keep your A1C less than 7. The American Association of Clinical Endocrinologists, all the diabetes gurus, would like to keep it a little closer to 6.5. Some of that varies with age. If I have an older person, maybe they're 75, 80 years old, and if they run a little bit high, that's probably safer, because if you get some of those older people and it gets too low, they tend to have more complications from a low blood sugar than they do a high blood sugar.
You kind of tailor that to the patient because you know them not just for their diabetes, but across the board. There are also some important things in diabetes in terms of eyes and feet.
Well, the diabetes can affect your circulation, and any part of your body that needs blood can be affected. Your brain, your eyes, your heart, your kidneys, your feet. So we like to recommend annual screening exams on your eyes, make sure it hasn't affected your eyes. We like to keep track of your heart. Unfortunately, people who have diabetes have a high chance of having heart disease. We also monitor your kidney function because it can affect your kidney function. And as you mentioned, the feet. I mean, you can have neuropathy, problems with circulation to your feet. You can lose your toes. So it's important to be followed by a foot doctor, eye doctor, heart doctor.
And you can do all that too.
As family physicians, we monitor all of those things. Now, I don't do heart surgery, I don't do kidney surgery, but we can direct you in the right direction.
All right, high blood pressure is another thing we see a lot of. Is there a certain number, a goal number there that you're looking for?
Well, the JNC comes out with guidelines as far as high blood pressure, pre-hypertension, different studies. A young person, I like to keep their blood pressure 120 over 70, okay? An older person, like I might let their blood pressure go up, I might like their blood sugar go up a little bit, still safely. But people who have high blood pressure and diabetes, that increases the risk of heart disease or increases the risk of stroke significantly.
Well, people who have diabetes and high blood pressure very commonly also have high cholesterol. So tell me the numbers there that you're looking for in terms of goal numbers.
Well, the total cholesterol is broken down into what we call the good cholesterol or HDL cholesterol, and then the LDL or bad cholesterol. And we want to keep your HDL, your good cholesterol up, your LDL low. Usually if we can keep your LDL, the bad cholesterol, under 100, we feel pretty comfortable. If you got a history of heart disease or kidney disease, we might try to see if we can get that LDL even lower. The newest guidelines recommend putting your blood pressure and your cholesterol and your smoking history all in an app, and then we calculate what's your risk of having heart disease. Do we need to treat this with a pill, or do we need to slap you on the wrist and tell you to stay away from the fast food?
Well, I always tell my patients if it tastes good, spit it out, and that's if it tastes good like cardboard, you can eat all you want. So, we talked a little bit about diseases and goal numbers for diseases, but there's also some screening things when you come in for your diabetic check or your bronchitis. We may also talk to you about colonoscopy.
Colon cancer is one of the most common forms of cancer in the United States. We recommend a colonoscopy, usually age 50. We might bring that number down lower if you got a family history of colon cancer. If you have problems at younger than age 50, so changes in your bowel habits, blood, I'm not going to tell you to wait and come back when you're 50. But usually at age 50, we recommend starting some kind of test. I like to recommend the colonoscopy. There are other colon cancer screening tests that we can do. I'm not quite as fond of them.
You also look at immunizations a lot, things that you can give to keep yourself self healthy. So even though, like I say, they're in there for a disease, we're going to say, hey, have you had your tetanus shot and other things?
Well, the tetanus shot should be given every 10 years. We have a kind of a new one now that's good against not only tetanus, but the whooping cough or pertussis. Everybody age 6 months or older, which is pretty much everybody, should get a flu shot. If you have any of these chronic medical conditions, we're talking about diabetes, blood pressure, you should get a pneumonia shot. We usually recommend it in people who are 65 and older, but we don't have to wait till you're 65 if you have any kind of chronic medical condition, even asthma.
Well, that's great information. So even though you come for sickness, we're going to try to keep you healthy, keep you focused on managing your chronic disease. We'll be right back after